Hey everyone, this is Katie Sheridan. Gonna talk to you guys really quick about situational anxiety. Situational anxiety is a form of anxiety that recurs in response to a specific situation. Some of the things that people may experience are feelings of worry, trouble sleeping prior to the situation that causes them anxiety, or panic. This is a very common form of anxiety that can be considered normal because we all feel sometimes nervous in response to a job interview, or going on a plane, or speaking in front of people. But this becomes a problem when it starts affecting our everyday life, especially when it can cause a panic attack, which is an episode of intense anxiety or fear. People will even sometimes commonly avoid situations that cause anxiety. The thing about this is that it's not recognized as a condition in the Diagnostic and Statistical Manual of Mental Disorders, which is a clinical manual that doctors utilize to diagnose mental health conditions. People, the risk factors for this tends to be triggered by new or changing situations. When people feel like they don't have any control over the situation, or may occur when people have had negative or uncomfortable situations in the past, or major life changes such as getting married, getting divorced, having a baby, or being more susceptible to anxiety in general, such as genetics, brain chemistry, and environmental influences. Questions that you should ask for diagnosis include: do your feelings of anxiety always occur in relation to the same situations, such as public speaking, job interviews, meeting new people, getting on an airplane? And have you had a bad experience in the past with that specific situation? And do you have a personal history of mental health disorders, or a family history of mental health disorders? Because we know that puts them at risk for this. It is very important to distinguish this from generalized anxiety disorder. This type of anxiety only occurs in response to a specific situation. On the physical exam findings, the diagnosis of a mental health disorder is based primarily on a thorough history and physical exam. The physical exam may include lab work that would often be normal. During an acute exacerbation of situational anxiety, patients may experience diarrhea, difficulty concentrating, dizziness, dry mouth, lightheadedness, tachycardia, tachypnea, irritability, muscle tension, nausea, nervousness, restlessness, trembling, or sweating. But it's important to understand that this is a mental health disorder and is based on a thorough history. Common treatments is often controlled with self-help strategies. If symptoms impair daily life, they may be interested in psychotherapy, such as cognitive behavioral therapy, or medication therapy, such as Xanax, Klonopin, or Ativan, which you only take PRN. Things that you would want to teach your patients about situational anxiety is to prepare for situations that may cause anxiety. Adequately preparing to manage whatever may happen will help alleviate anxiety. So being able to prepare for something that might go wrong will help you feel better. And exposing yourself to your fears. Once people are exposed to their fears, they realize it poses little danger. So if your fear was public speaking, the more you public speak, the less you realize that something big, bad, and scary would happen because of it. And then challenge your negative thoughts with more positive, realistic ones. Odds are, your plane's not going to crash. So it's important to let your mind focus on more realistic thoughts, and using relaxation strategies such as deep breathing and visualization. These are my references. I hope that this helped us. I know that we all have struggled with situational anxiety at times, and I think that it's important. Maybe this should be something that should be added to the diagnostic criteria for mental health disorders.